definition for diabetes second Merriam-Webster dictionary is a serious disease in which the body cannot properly control the amount of sugar in your blood because it does not have enough insulin.
For some reason, the body stops producing sufficient amounts of insulin, which causes the glucose to not be absorbed by the cells and remain in the bloodstream.
Glucose is the most important source of energy for the body, but for it to be used, it needs to be inside the cells. When it is present in circulation in large quantities, it is extremely toxic and can cause various damages to the person's body. According to the American Diabetes Association, every woman who has never had high levels of blood glucose before, but present them during pregnancy, is known to carry gestational diabetes.
The American Diabetes Association also said that it is unclear why diabetes occurs in pregnancy, but one of the hypotheses defended is insulin resistance hinders its use in the body of the mother, which demands greater consumption and production of this hormone through the body.
Gestational diabetes begins when the body stops being able to produce sufficient amounts of insulin capable of causing the cells to absorb glucose and turn into energy during gestation. Gestational diabetes has no symptoms. For this reason, the medical recommendation is that all pregnant women between 24 and 28 weeks of pregnancy need to be tested, because the non-treatment of the disease leads to an increase in maternal and perinatal morbidity. The prevalence of the disease is high. About 10% of pregnant women over 30 years old presented the disease in 2010, and the incidence is higher in pregnant women over 40 years old, around 13% second CTV News. According to the Mayo Clinic, among the complications for the baby are excessive birth weight, early preterm birth, and respiratory distress syndrome, low blood sugar, hypoglycemia, type 2 diabetes later in life. Mayo Clinic also say that the complications that may affect the mother are high blood pressure and preeclampsia, future diabetes. However, making healthy lifestyle choices such as eating healthy foods and exercising can help reduce the risk of future type 2 diabetes. The good news for women who have history of diabetes during the pregnancy is that for those who reach their ideal body weight after delivery, fewer than 1 in 4 eventually develops type 2 diabetes.